Well, I want to thank RAADfest and the Coalition for inviting me to speak. I do a lot of different things. I have a clinic here locally in the greater Las Vegas area, in Henderson, if you've heard of it. And one of the things that drew me to RAADfest was, we're looking for escape velocity here, but our moving parts still tend to wear out. So we do a lot of joint and spine work to keep those parts renewed while we achieve escape velocity. So here we go. By the way, I'm going to go fast through a lot of slides. Don't take notes. At the end, there'll be an opportunity for you to take a picture of a QR code where you can have your own set of these slides and look at them later. Okay? Anyway, heal naturally. And anyone can benefit from regenerative medicine, right? This is nature. This is the very blueprint that helped form us in the first place in the womb. And what happens is we have stem cells in us, and those stem cells help us renew and restore and heal. And we do a great job of that as young people. But those stem cells tend to lose their oomph. We can do our best to take care of them, help release them. We can do things like fasting, high-intensity exercise, take certain supplements. But sometimes you need a little extra help, and that's what this talk is all about. We have these through life. And as the stem cells don't work as well, and the stem cell messaging, which we'll get into, we tend to have aging. We tend to have diseases. And the more diseases you have, the more aged you are. And the more aged you are, the more risk of disease. So stem cell numbers decline, their activities decline, and we call this inflammation or inflammaging, right? The cell activities accumulate junk, the plasma accumulates junk, and our cells just aren't doing what they want to. And some of them even become so bad they're not useful, but they hang around taking up resources. Those are called senescent cells or zombie cells. We've heard of those, right? All right, so we don't want this accumulating inflammation or inflammaging. So what do we do about it? How do we slow this down? How do we slow the aging process while we're waiting for all these answers on how to escape aging? How do we delay and prevent and reverse disease processes related to inflammation, but without pharmaceuticals, without steroids, because steroids might help in the moment, but long-term they have degenerative capacity. We don't want that. Without surgery, right? We don't want to have the downtime, the pain. I mean, can't I take a bunch of Advil? That's slowing my inflammation. Well, there are reasons for that. Advil is pharmaceutical. It only works on one of the cellular pathways of inflammation. There are many. So you can't just take an anti-inflammatory like that. All right, so Dr. Jeff, I've heard of stem cells, but my doctor doesn't offer them. But if you've walked around the exhibit hall, you've seen lots of stem cell and exosome booths, and we'll talk about exosomes here in a moment. And they're available, and they're available here in the US and other places. Other places had them first. So where do we get them? Well, they can come from various tissues. We have stem cells throughout our body. Most of them are in the bone marrow, but other places too. And you can get them from your own body, a donor, or a very young source, like perinatal source. Like a mother has a healthy child, congratulations. We're going to throw away your placenta, your umbilical cord, your amniotic fluid. But now that medical trash is now medical treasure. So when you change the oil in your car, you don't put the old oil back in. So I like the younger, fresh, unadulterated, uninflamed stuff. And this is like, the experiment where you connect the vascular systems of an old mouse to a young mouse, and the old mouse begins to have features of a young mouse, and vice versa. Well, if you get these biologics, we call them, from the womb, you're getting the young mouse stuff. So we like that. It's the most active group of stem cells. So something occurred to me in my residency, and yes, I'm a recovering neurosurgeon, spine surgeon. And in my residency a long time ago, we started doing surgery on something called spina bifida. That's where there's an accidental opening in the spine in the fetus. And those children are born, and they tend to have problems with using their legs and other things, from the nerves on down. Well, it turned out if you closed that defect early, even in the uterus, those children would be born with less deficits. So we started doing this surgery in the womb. And fetoscopic surgery, we'd open the womb, we'd just close it together. It wasn't elaborate. And they would be born with a closed back. Something occurred to me. Some of them barely had any scars. Interesting. What's going on in that amniotic fluid? What is the magic that's happening? And I wasn't the first to notice this. I did a little homework, as I tend to do in my nerdy pursuits and deep dives, and I found this article, which was around the time I graduated med school, where someone else had noticed scarless fetal healing. Something is cool about the amniotic fluid, right? So what's in there? Well, we have stem cells, tons of them. They're youthful. They haven't had a life of EMFs and bad food and seed oils and whatever else, stress. And proteins, collagen, growth factors, and something called extracellular vesicles. What are these? Good question. So let's back up just a second, though. If we took everyone in this room and I gave you a stem cell infusion in your vein, intravenous, those cells will be gone from your system in 10 to 14 days. Like, hey, I just spent all this money. How come they're gone? But don't worry, the benefits last much longer than 10 to 14 days, some of the benefits being permanent. Well, wait a minute, but the cells are gone. What's going on? How can that continue lasting? Well, there's some messaging going on. There's a chain that's communicating from those stem cells to us, to our cells. Our cells are doing the work at the end of the day. Okay, so you're taking my old inflammaged cells and you're giving them a signal, a new set of instructions to behave more youthfully. I like that. How is that happening? Well, it's happening through small protein fragments of peptides that those stem cells have given us. That's called a paracrine signal. And also through these extracellular vesicles. So a cell, can give off thousands of these in a day. All cells make these vesicles. We used to think they were waste. And the vesicle has a little bit of a membrane, and in it some communication contents, where one cell communicates with its neighbors, and the neighbors take it in. And guess what we call these extracellular vesicles? Exosomes. And we've all seen that word here in the exhibit hall, and you've probably heard it from some other talks, and you're going to hear more and more because exosomes are the main business end of cell communication. They are how stem cells work. So when those stem cells leave your system in 10 to 14 days, it's the exosomes that communicated with your cells and reset the factory of those cells to factory settings so they could work in a more youthful, restorative way. That's what's going on. And you can have exosomes found in PRP, you can have them found in stem cell populations, you can have them in amniotic fluid. Okay, so let's look at this. These are available in the US from donors. They're fully screened and tested. They're supplied by FDA certified and compliant labs. And the ones we use have not had the COVID vaccine, just in case. An exosome is a cell-like structure, but about 1/1000th the size. It contains mRNAs, no real appreciable DNA, no genes. It has lots of growth factors and proteins like heat shock proteins. Who's heard of heat shock proteins? Me? I have. You have? Okay, you have. So if the benefits of hot sauna, for example, come from release of these heat shock proteins. They go throughout all species. They're very primitive survival proteins that help our cells behave better. These are the kind of things you release when you fast and you clear out those senescent cells, right? Exosomes are immunoprivileged. You don't have to have a matching set of them. They don't have a lot of cell surface markers. They're sort of naive and neutral to our system. And they're small. Well, wait, Jeff, cells are small. These are even smaller. So they can pass through the blood-brain barrier and other places. They provide an anti-aging epigenetic influence to your cells that have been hanging around accumulating junk. Well, maybe not this crowd, but a lot of crowds. All right, so how do they work? So they influence the cell activity, what's going on. We call that cell metabolism in the biochemistry circles, but basically, are our cells busy defending against all the craziness in the world, or are our cells in the most optimal functioning mode? We call that the anti-inflammatory mode. So that's how they work. And when we use exosomes from the amniotic fluid, these are typically MSC-derived. MSC is sometimes, referred to as a type of stem cell, but really it's a mesenchymal stromal cell. It's a basic cell that we find in the amniotic fluid, in the umbilical cord, and it gives us a factory reset. I call that stem cell activation, and really I should call it just cell activation, good activation. You ever seen a pregnant lady? Ever been a pregnant lady, some of you? And your skin was aglow, and your hair was growing crazy, your nails were growing crazy, and generally you felt good, maybe some back pain, of course, from carrying a baby. But that's because you're getting a daily dose of stem cell-derived exosomes traveling through the placenta. You're not getting stem cells because they're too big to pass the placental membrane. So a pregnant woman is an example, the benefits she gets. Now, she should get these. She needs to have a survival advantage because she's carrying on the species, right? So we can all get that now. Where else can you find exosomes? Well, you can find them in certain foods: bone marrow, bone broth, chicken soup, colostrums, mother's milk. Why does grandma make you chicken soup when you're sick? She didn't know it, but chock full, bless you, chock full of exosomes. We also now have a plant-derived exosomes. A lot of the phytonutrients we get from plants, like resveratrol, spermidine, quercetin, fisetin, glutathione, most of the B vitamins, not B12, vitamin C, and others, are actually encapsulated by the plants in plant-derived exosomes. And we now, if you come visit our booth, we have a plant-derived oral nutraceutical from some curated Italian organic fruits called Longevex. I'll get back to that in a second. And we just launched this in May. It's very exciting for us, hopefully for you too. It is bioavailable because the plant-derived exosome membranes survive our gastrointestinal tract better than a mammal or animal exosome. So it gets into our bloodstream, and this is the only regenerative supplement on the market that's truly a regenerative particle. It has been shown in our research to significantly increase sirtuin-1 gene, which is, many of you know, a mitochondrial anti-aging gene. And that activity is increased. It reduces reactive oxygen species and other markers of inflammation and DNA damage. So this is a one a day, and you can get rid of a handful of other supplements you may be taking. Come by the booth and talk to us about it. We have for anyone that's in this audience, we have a special code for you. And I believe the code is RAADfest or RAAD. Just tell our staff, and we'll make sure you get an additional bonus when you come by. Anyway, there's a ton of research on this, and we have a magazine you can pick up that has an article and references on plant-derived exosomes. So this replaces, as I said, a lot of items. And that's just the beginning. We have many more things coming in from the plants. Nature's figured this out for us. We've evolved around it. We're just tapping back into it with new knowledge. So, Doc, why should I have exosomes? I can have stem cells, right? I can go down to Colombia, Panama, wherever, get stem cells. Well, you can. That's fine. You're going to get the exosomes from them because exosomes are the business end. But exosomes are really we're cutting out the middleman when you skip the stem cells. There is a small risk of rejection of cells, but not exosomes. I've never seen it, but just to mention it, if you have stem cells intravenous, most of the cells are sticky. A lot of them end up in the heart and lungs, which is great for your heart and lungs if you're recovering from a heart attack, if you've got heart issues, lung issues. That might be an acceptable strategy. But exosomes are so small, they're part of the body fluid. They go everywhere. They cross the blood-brain barrier, and they're a fraction of the cost. So we like that. Why? Amniotic fluid is so abundant compared to an umbilical cord. Okay? So, but docs, I heard all this is illegal in the U.S. Yeah, there are some myths out there. I'd probably put around by Big Pharma. But remember, FDA does not regulate the practice of medicine. FDA regulates marketing claims. They protect the consumer. So we're not allowed to make any claims that we treat or cure a disease or condition, even though as a neurosurgeon, I was never able to guarantee an outcome anyway. So this falls right within that. So I have a duty, it's called the Hippocratic Oath, to protect my patients and make sure that you have access to these types of things if you want them and if they are an option for you. Okay, some states are actually moving to allow claims to be made. Utah was the first. Florida now recently has done something. It doesn't change anything. It just allows doctors to exercise more free speech. But everything we do is based on science, medical evidence. And people come to me with new problems all the time, and we see if there's a potential solution in the literature. A lot of what we do is based on good work done in Europe and Asia for 2 decades. We're just late to the party. So I'm a big fan of, we're the source of exosomes. Fresh frozen amniotic fluid is the freshest source. That's what I use for people. It's filtered, tested, screened. Every dose comes with pages and pages of viral testing or what have you. And you have to have a good count. So we start at 520 billion and go up into the low trillions. If you stop by our booth, there's a whole schematic of that. You see other companies might use a powdered version. You lose some of the bioavailability and the bioactivity. You rupture some of the exosomes when you do that. And some are, this should say cell culture secretome. Those are usually very small numbers. You lose all the growth factors in those too. So if you're going to do this, go with the fresh frozen amniotic. That's the good stuff. And what can we do with this stuff? Without making a claim, for educational purposes only, We have had people benefit from treating joint osteoarthritis, osteoporosis, because we need to stimulate it. Bone density is correlated with longevity, as is muscle mass. So we have to support bone and muscle. The body tends to survive if you move it. It tends to respond in a survival way. So if you can take away anything from this talk, it's keep exercising, keep moving. We've had improvement in cell metabolism, different types of issues, organ function, bringing back people who are just about to go on dialysis from needing that, all kinds of different things here. But let me focus for a moment on osteoarthritis. It's the low-hanging fruit in regenerative medicine. It's easy to treat. And if we're going to live long, you got to keep these moving parts happy, right? Because if you know you need to exercise, but your knee's killing you, you're less likely to do it, right? So the disease, I put that in quotes, of osteoarthritis is one of an inflammatory metabolic change in the cells that make and maintain cartilage, not the cartilage. Let's make sure we say that again. Wear and tear of the cartilage is the result. It's not the root cause. The cartilage is a protein. Just like your hair is a protein made by a cell in your scalp called a follicle, the protein of cartilage is made in a cell in your bone edge above and below the joint in what used to be a growth plate. And what made that joint in the first place, what made that cartilage in the first place. And those cells are called chondrocytes, cartilage cells. Those chondrocytes over time get cranky and inflamed more likely than any other cells in the musculoskeletal system. And then when they're cranky and inflamed, they cannot maintain and then produce cartilage. As a result, the cartilage, you have wear and tear of the cartilage. And that's called osteoarthritis, or bone on bone, or chondromalacia, or wear and tear. We could give it lots of different names, but your doctor probably says you have arthritis. And that doesn't tell the whole story. Okay? So how do you help these cells? Well, you re-stimulate them, you activate them, you use regenerative medicine. Now, most doctors will inject the joint space where the cartilage is. And I understand, that's an easy access, most doctors can do that. Turns out, the results are not as good as injecting the bone edge, and let me show you that. So how do we do it? We look at a very high quality MRI. The MRI here on the left of the screen shows this whitish area, and the whitish area, I think I have a laser here. Oh, forgive me. The whitish area in the bone edge is the inflamed area where nearby there's thinning of the cartilage. On the far side of the screen, on the right, is a normal appearing knee where the bone is very uniformly gray and granular. But everyone can see the cranky white area on the far side of this close picture. That is the demonstration of cranky chondrocyte bones in the bone marrow that cannot maintain the cartilage underneath. It can be from injury, it can be from, just chronic misuse or disuse or poor weight bearing or just life, just bad metabolism. And people will tell you if you have joint pain, but you start eating a really clean diet, get rid of gluten, a few other things, and go to an anti-inflammatory lifestyle, your joints feel better. This is why. Okay. So joints, why do we not inject the cartilage? There's not a lot of cells in there. Cartilage is like biological rubber. It's barely alive. Again, you have to support the bone. So I didn't figure this out. Dr. Herngu in France 20 years ago started doing stem cell injections to the bone edge. And he did a study. And that study, the results at the 15-year follow-up are shown on the right. They took patients who said they need a knee replacement. They were already bone on bone, needed a knee replacement, and said, hey, before you do that knee replacement, would you like to join our study? A lot of them said, sure, that's a no-brainer. Or in French, oui, this is what they said. And they took half the patients and they injected them right in the cartilage, like I told you, and half the patients right in the bone edge. And if you look at the graph, the blue is the bone injected, and the red is the joint injected. And they followed these patients out for 15 years and published every 15 years. And this was some time ago. I'm hoping they published their 20-year. But initially, everyone did well and was able to escape, that's the theme here, escape the need for knee replacement. Over time, though, people in the joint injected group, the red plot, started to have problems again. And even you wait long enough, some of the people in the bone injector group started having problems. But at the 15-year mark, less than 25% of the patients were still doing well. And then they needed a knee replacement again. Where over 80% of the patients who had the bone injector group were still doing great. So the better result, the longer lasting result, has clearly been demonstrated to be the bone injection. So that's where the happening is. That's where the party is. Now you might say, well, can someone do another injection and rejoin the group? Yeah, they sure could. It just wasn't part of the study. So here's an example of my own I like to show. This is a 52-year-old female athlete, old knee problems, prior knee scope, skiing injuries, trouble walking, MRI read grade 2 to 3 chondromalacia of the medial femoral condyle. That means where the meniscus is. Grade 2 chondromalacia, the patella, where the kneecap is. Chondromalacia is code for cartilage wear and tear. It goes up to grade 4. Grade 4 is considered bone on bone. Grade 0 is normal. So we injected the amniotic exosomes into her kneecap and her medial compartment 3 months after this MRI, about June of 2021. She felt great. She had initial good results, felt better because of the anti-inflammatory effect. It's like a cortisone shot without the downside of cortisone. But months later, I said, hey, I need some befores and afters. Will you do an MRI for me? She didn't really need one, but she said, sure. So the MRI, I didn't tell the radiologist anything. This is the same MRI center, essentially the same slice, same technique. Read the MRI as mild cartilage irregularity with mild thinning. They didn't even give it a grade. So I said, okay, I'm conservative. I'll call it no worse than a grade 1. So she reversed her cartilage degeneration. She reversed her osteoarthritis. It is possible to regrow cartilage. I'm showing it to you right here and right now. And this is just cartilage. Think of all the other things we are doing and can do. So yes, we can help someone. I tried to make the cartilage that runs behind the kneecap when you bend your knee is that reverse J in the gold color. Above is the before, and below is the after. Look how thick the cartilage got after the treatment. So do you really want this knee replacement? I don't. How do we do these? Yes, they are a bone injection. Yes, that could hurt. That's why we do them under light sedation. I use an x-ray guidance. You can see in the x-ray picture the needle going into the bone. It doesn't take but 10 minutes a knee. All the hard work is done ahead of time. A good quality MRI, a good clinical correlation, and seeing if you're a candidate, if there's a target. What else can we do? The knees are the low-hanging fruit because there's so many of them, they respond so nicely. But we do foot, ankles, toes, fingers, everything, okay? What about spine? Doc, weren't you a spine doctor? Aren't you a spine surgeon? Yes, that's why I got into this. So if you look at the MRIs here on the side, you see the white cranky bone edge above and below a disc. That's what you're looking at. And we have some benefits in the cartilage of the disc by injecting the bone edge here. That's the target, not the disc. The disc is the downstream effect, losing the disc properties. So remember this, degeneration is not just structural, okay? It's metabolic, it's chemistry, it's cellular activity. And the opposite of that is to regenerate. So again, the opposite of degeneration is regeneration. Well, these exosomes sound cool. What else can you do? Well, we can help any cell almost in the body that's having trouble, that's inflamed, behave better. Okay, we have, and again, these cross the blood-brain barrier. We can help things with, in the neurologic system, cognitive function, metabolic issues, long inflammatory infections like long COVID, like results of Lyme's disease, autoimmune issue. These are hyperinflamed states. Irritable bowel, psoriasis, anywhere you have too much inflammation that the body just seems to not be able to get under control for some reason. We have also use it for anti-aging purposes, for biohackers, for longevity enthusiasts. Are any of those here today? I am. I'm one. I do this every 3 months in an IV. My mother's 82, my stepfather's 86. They come in from Phoenix every 6 months to get their oil change. And this is what we want. We want you to be the 70-year-old here, not the 70-year-old there. But in this group, I should change this to 112 years old or beyond, right? But how you are on the inside in your cells you'll manifest in some ways on the outside, right? So that's what we're doing with these things. We also have some aesthetic and cosmetic uses. People with bone density problems, there is a great body of literature showing the use of stem cell-derived exosomes to help stimulate bone growth. Again, we have to make sure the body's all set up in all the ways, not just they're not a magic bullet, right? You have to be hormonally optimized, and diet and sleep and exercise and mindset, and everything should be part of that. Sexual function shots for both men and women. People looking for muscle gains in addition to maybe peptides and the right exercise program and what have you. And this is what we're doing with regenerative medicine. Well, Doc, what about cancer? Can I take these for cancer? No, not these. We don't know. We don't have enough data for me to be comfortable giving this to someone with cancer. But wait. There's something called the natural killer cell. Who's heard of natural killer cells? Me too. Natural killer cells have a job. Their job is to remove crazy abnormal cells in our body, including cancer cells, senescent zombie cells, maybe parasite-infected cells, a few other things. And they do that selectively. They're very selective, right? They don't hurt our normal cells. So there's a lot of work with natural killer cells and doing that, but they're hard to come by. Yeah, they're a very small percentage of your immune system to begin with. And these natural killer cells make exosomes. They make their own special exosomes called NK exosomes. And they've had them in Europe and Asia, and we actually now have some in our clinic here in Henderson, and we have been using them for people with cancer. They can be used IV. They can be used as an adjunct to a traditional treatment course. They can be used separate from if you're not a candidate for or just don't want poisons in your body. That wasn't judgment. We treat all types. They can be used intravenous. They can also be injected into the tumor. If you stop by our booth, we have a magazine. I wrote an article on this. It has like 40 references in the literature. I did not come up with this. I'm just trying to make it available to people, and we do have some doses available. Because we do a lot of injections, we're going to be doing more intratumoral injections with the NK exosomes, and I do a lot of joints and spine. We're opening a state-of-the-art injection facility with 3D low-field CT scan here in Henderson, Nevada, very, very soon near our clinic. And it looks like this briefly. I won't labor you with the entire video, but we have this imaging robot. It will come in. It can act as an X-ray, a fluoroscope, a CAT scan. We have special tables. The patient will be able to get very low radiation, allow us to inject with precision without surgery, very deep spots in the body. Okay? So regenerative medicine is not something in the future. It's actually here now. It's been in Europe and Asia for a long time, and it's here. Tap into it. Thank you for growing with us, for being part of this. Thank you. Please follow us at ReCelebrate is our business. It's ReCelebrate because you're celebrating the renewal of your cells. At ReCelebrate on Instagram and all the other channels. Contact me. We have an email for you. And I know I went through that fast. We have some very special promo pricing if you're interested in trying the IV exosomes. We work with our supplier, the lab, and they take out their margin, we take out our margin so people can try this. Stop by the booth. This will be your last opportunity today to lock these prices in for the next year. And then if you want to download a copy of the presentation, there you go. And look us up at ReCelebrate. And I'd love to answer any questions. I don't want to monopolize the room because there are other speakers, so maybe we'll step outside or over back to the booth. But if it's crazy and you don't get a chance to talk to me, please just reach out to us. I'll talk to you next week. We can get on the phone together. I love meeting new people, and everyone's got some new idea, and I'll have to look it up. Let's do that. Everyone got the picture? No? Don't forget to follow us. We're just like 900 people away from 5,000 followers. We could like jump 100 today if you all follow us on Instagram. All right, moving on to the next slide. If you're interested in the nutraceutical, we have some available here. And again, there's a promo discount. Come by the booth, say RAADfest, I was at the talk. And then if you want to get some, it's here, the website. It's one a day. It's a small capsule. And it can help, we all have pill fatigue from all the supplements we take. So this can help you replace a bunch of them. Thank you very much for listening to me. I hope that was helpful.